Could you discuss the importance of David Kim et al.'s recent analysis of current rates of transmitted antiretroviral resistance?
David Kim conducted a study from 2007 to 2010, which incorporated screening 10,000 or more men over those past few years to determine the rate of transmitted ARV resistance. They found that the rate is relatively stable. It's ranging from 15 to 17%, with the average being 16%. There was a slight increase from 2007 to 2010, but non-significant. The importance, the significance of this finding is that although we are treating more individuals with antiretroviral drugs, the rate of resistance that's being transmitted during primary infection remains relatively stable. It is not increasing. It was actually higher in earlier years when we were doing one drug, two drug regimens. But now that we have more potent regimens, that people are adhering more effectively to these drugs, we're not seeing a rise in antiretroviral drug resistance in primary infection. So that's the first finding. The second is, what does this mean to clinicians? It's very important that when a clinician identifies a newly infected individual, someone who has seroconverted, they should obtain a genotypic resistance profile test so that they can determine whether any of the drugs that they are considering to put the patient on, the individual might be resistant to. If we're running 1 out of 7 resistant patients, that is resistant to the first-line regimens, then that's a significant number that it justifies ordering the resistance profile test.